what's the weirdest thing you've ever seen in vascular surgery? Like somebody, like I've heard stories about somebody's had a dead toe and it's just been dead for weeks and weeks or months and months. Or well, what's the weirdest thing you've ever seen in vascular surgery practice?
Well, gosh,
And it's a small world. We can change names.
Yeah. Only about 20 things come to mind immediately. But
tell me 2 or 3, please.
When I was a medical student, I was a second year, and we had a class called Introduction to Clinical Medicine. And that Introduction to Clinical Medicine was all about how to do a history correctly and how to do a physical exam correctly. And so you would get a second or third year medicine resident. And you got to remember, this is at UT Southwestern. So Parkland, the big city hospital in Dallas, just an incredible place, and a wealth of teaching opportunities, if you will, in that hospital. And so what we would do is the resident would spend probably 5 to 10 hours with each of us, showing us the different aspects of how to elicit a history and how to do an exam. And then he would take us over to the hospital, and he would have picked out a patient, and he wouldn't tell you anything about the patient. You would go in, and you would spend a couple of hours with the patient trying to figure out exactly what's wrong. So you weren't supposed to get in the chart or anything like that. And while you were doing that, the resident would stand in the hallway and he would listen to you. And there would be times he would kind of peek in and so forth. And the families and the patients knew that, hey, these were students and they're learning, and would you consent to this? And, do you have any problem with it? Da, da, da. And almost everybody would consent to it, because it was that type of atmosphere where everybody was just really interested in doing anything they could to advance medicine. So I had this resident, and he taught me all the finer points of the history and the physical exam. And so I went over, and I'm interviewing this patient, and I get through the history, and I'm doing the physical exam. And so I pull my stethoscope out, and I do exactly as my resident had taught me to do. I take the stethoscope and I put it on top of the head to listen for any abnormal sounds in this one area over the cranium that you can hear inside the cranium. Now, you got to understand that hardly anybody ever does. In fact, I've never met another person that does this, but he felt very strongly about this. So I pull my stethoscope out, and I place it on top of this lady's head who was in her 60s and was there for a totally different reason than anything having to do with her brain. And her daughter is sitting there, and she'd been intently listening to this whole thing with the history and was really into this. And she turned to her sister who was next to her, and she said, I'll never forget this. I was so embarrassed. She said, "You can tell he's a student. He doesn't even know where the heart is." and even my resident was laughing a little bit, and I was so embarrassed. I didn't know what to do. So anyway.